Think about the modern medical industry. It operates like a massive, highly efficient industrial engine, engineered to extract financial value at every possible turn. This diagram maps how the money actually moves. Cash flows continuously between insurance companies, pharmacy benefit managers, and hospital systems. Notice what's missing from the loop. You. The patient sits completely isolated from the financial decisions determining your care. Back in the early 2000s, Anne Wojcicki was working as a healthcare investor on Wall Street. Over a decade of analyzing small-cap biotechs and massive hospital systems, she noticed a severe structural flaw in how the industry operates. She realized that the entire sector is built entirely on monetizing illness. Consider diabetes. If a doctor successfully prevents you from ever becoming diabetic, nobody makes a dime. But if you develop a chronic condition, you immediately become a highly profitable, lifelong revenue stream for multiple corporations. Because the patient isn't the one paying the actual bills, they have zero leverage. The core financial architecture of the medical sector operates in direct opposition to keeping human beings healthy. You can't reform a structure like this from the inside. The legacy institutions simply have too much capital tied up in maintaining the current routine. The investor Charlie Munger famously noted that incentives are a superpower. They dictate exactly how complex systems and the people within them will behave. Fixing it required an outside intervention, a Robin Hood maneuver designed to force an entirely new set of economic rules onto the playing field. Wojcicki concluded the only viable tactic was to put the individual directly in the power seat of their own medical choices. By shifting to a direct-to-consumer model, you sidestep the corporate middleman entirely. When the individual holds the wallet, they finally become the sole decision-maker. The timing was specific. By 2006, the cost of sequencing a human genome was dropping fast. At the exact same time, Web 2.0 and crowdsourced social networks were taking off. This led to a very specific hypothesis. If you treated human DNA like a massive crowdsourced dataset, you wouldn't need to rely on traditional gatekeepers like Harvard or Pfizer to make medical discoveries. The users could do it themselves. The physical mechanism for this bypass was a simple, affordable, direct-to-consumer spit kit. They launched 23andMe with highly publicized Silicon Valley spit parties. But the initial reality was grim. They hit what startups call the trough of sorrow, selling a tiny fraction of the kits they expected. They quickly identified the problem. Ordinary people had no idea what genetic data was or why they should want it. They had to launch a massive grassroots educational campaign to explain the medical utility of knowing your own DNA. Engineering the tech wasn't sufficient. Before the crowdsourcing engine could actually function, they had to teach the public exactly why owning their raw biological code was valuable. When the product finally gained traction, the traditional medical establishment panicked. Doctors publicly argued that ordinary people lacked the intelligence to interpret their own health data without professional supervision. This kind of professional panic happens predictably. Decades earlier, doctors lobbied aggressively against the first at-home pregnancy tests, claiming women couldn't possibly handle that information in their own bathrooms. This deep-rooted medical paternalism was standard practice. In a 1969 medical journal survey, over 90% of physicians admitted they would actively hide a cancer diagnosis from their own patients. The pushback eventually culminated with the Food and Drug Administration stepping in to strictly regulate the startup's medical claims. To survive, 23andMe had to drop the typical Silicon Valley move fast and break things attitude. Instead, they began rigorously publishing their findings in peer-reviewed scientific journals. Operating outside the system got them started, but to defeat a deeply entrenched regulatory body, they had to prove their accuracy using the strict, undeniable language of clinical data. A decade of navigating strict regulations yielded a massive asset, a highly engaged database of over 5 million genotyped individuals. Millions of consumer profiles feed directly into a central hub, instantly outputting medical discoveries back to users. This highlights gene by environment. Having a genetic marker for a disease doesn't guarantee you'll get it. Your lifestyle choices play a massive role. By scaling a massive community entirely outside the legacy system, they created a business model where the financial incentive is tied strictly to keeping people healthy rather than treating them after they fall ill. Because users opt in to research, the company can run massive behavioral intervention studies. They recently conducted a weight loss trial using 70,000 active participants to see how different DNA profiles respond to specific diets. The long-term goal extends past simply identifying your genetic risks. They want to provide exact, personalized instructions tailored to your specific biology to help you live a healthy life to age 100. Consumers are no longer sitting in waiting rooms asking for permission. They are actively managing and reading their own biological code. The success of this model proves that the most effective way to hack the medical industry is to hand people their own operating instructions. It pulls human health out of the hands of corporate commodities and returns it to personal responsibility.